Right now, an invisible film of bacteria is colonizing the surface of your teeth, quietly seeking a way beneath the gum line. This chart highlights the infection rate among UK adults aged 50 to 59. A staggering 71% of this demographic is living with some degree of gum recession. Many people notice their gums receding or spot a little pink in the sink when brushing, and they write it off. They assume losing a bit of gum tissue is simply a natural, unavoidable part of getting older. The biological reality is highly specific. As we cross into our 50s, natural bone resorption and reduced saliva production create vulnerabilities in the mouth. Combine those factors with decades of bacterial accumulation, and the result is an active, destructive infection. Gum disease is a compounding biological and financial threat. Once it takes hold, the path you choose to treat it, navigating between NHS bans and private specialists, will strictly dictate the ultimate cost to your health and your wallet. The escalation begins at stage 1, known as gingivitis. The warning signs are entirely visual and physical: red, swollen soft tissue that often bleeds during routine brushing or flossing. The crucial biological distinction at this point is that the bacteria have not yet breached the gum line. The inflammation is confined entirely to the soft tissue, meaning the damage is 100% reversible. Because the infection is superficial, the financial remedy is highly efficient. Under the NHS, treating gingivitis falls firmly into Band 2, carrying a fixed cost of £76.60. That single charge covers a comprehensive professional deep clean. A hygienist will scale and polish the teeth, physically scraping away the hardened tartar above the gum line that brushing at home cannot remove. Recognizing these early warning signs allows you to completely eradicate the disease for less than £80 on the NHS. Stage 1 is a highly cost-effective but fleeting window of opportunity. This diagram illustrates what happens when we miss that window. Bacteria breach the gum line, creating pockets around the teeth. Dentists measure these taps clinically. Anything reaching 4 millimeters or deeper signals the start of stage 2. This is periodontitis. The infection is now actively degrading the periodontal ligament and the underlying bone. The structural damage is permanent, but with immediate intervention, the condition is entirely manageable. At this crossroads, the NHS treatment pathway holds steady. Periodontal deep cleaning, which includes scaling below the gum line and root planing, remains covered by the same Band 2 charge of £76.60, usually requiring 1 or 2 standard visits. The private route immediately escalates. Private specialists typically break this exact same subgingival stilling and root planing into 2 to 4 intensive sessions, pushing your total out-of-pocket costs to between £400 and £1,600. Private clinics often utilize laser-assisted periodontal therapy to manage these deeper pockets. By directing targeted laser light below the gum line, they can rapidly disinfect the area, significantly reducing bleeding and shortening the physical recovery time. That specific technological advantage carries a premium of £300 to £800, and you will almost never find it available through standard NHS services. Crossing the threshold into periodontitis triggers a steep financial escalation. Seeking the advanced comfort and rapid scheduling of private care multiplies your treatment costs by up to 20 times. If the infection is left untreated, you reach stage 3, advanced periodontitis. The hallmark of this stage is severe bone loss, resulting in high tooth mobility, bringing an immediate, highly probable threat of permanent tooth loss. The NHS does provide a safety net for advanced cases. Your dentist can issue a hospital referral for periodontal flap surgery or bone grafting, and this secondary care is entirely funded by the state. The critical flaw in that safety net is time. Waiting lists for NHS secondary care span between 8 and 16 weeks. That leaves patients suspended in a state of high anxiety, actively risking further irreversible bone degradation while waiting for a surgeon. The private alternative eliminates the wait, offering advanced surgical intervention within days or weeks, but bypassing the queue carries a heavy financial penalty, with surgical costs ranging from £1,000 to over £4,000. Decades of compounding biological neglect eventually force a brutal ultimatum. You must either endure terrifying wait times for free NHS surgery or liquidate thousands of pounds in savings to immediately rescue your teeth. This graph maps the true trajectory of the disease. A routine £76 intervention at stage 1 operates on a flat, manageable baseline. But let the bacteria spread, and that minor fee rapidly accelerates into a surgical crisis, costing thousands of pounds. The core operational rule of the UK dental system is highly absolute. Whether you rely entirely on the NHS or utilize private specialists, the system heavily rewards early detection and severely penalizes delay. You take control of this timeline by booking a professional diagnostic exam. Have a dentist explicitly measure your periodontal pocket depths and establish exactly where you stand. An NHS Band 1 diagnostic examination costs exactly £27.90. That single assessment is the ultimate low-cost preventative investment against a future financial catastrophe. Do not ignore bleeding gums or chalk it up to getting older. Address the warning signs today to proactively protect both your physical health and your financial assets. Armed with exact pocket measurements and a clear understanding of the costs, you can defeat the myth of inevitable decline and remain in total control. As always, this information is for educational purposes only. Please consult your dentist, GP, or a qualified healthcare professional before making decisions about dental treatment.